So our subject today is to use the new use for the hyaluronidase for the prevention of scar recurrence. And scar is never predictable. With all of the treatment modalities, the recurrence rate is between 50 to 80%. That's why we choose this type of the study. All we know that how we deal with these types of scar regarding the W technique, Z-plast technique, elliptical excision technique for most of our patients. Now with the revolution, with the presence of the CO2 fractional laser, we are using these type of treatment modalities. Still, we have a high level of recurrence rate. For me, as myself, I have one problematic patient that he was not satisfied with his results. أتذكر يعني لحد الآن مريض جاي من العمارة بس ما يجون عندنا أهل العمارة كان مغلوب قامة فسويت له العملية رجع يعني كان كلش انشياس وما راح قلت له ما قلت لك حيروح كله المهم طلع الخارج وضرب سيارتي وشرد. ف from that time I start to search what is the best to be done for the patient. Next. So, can a scar revision incur another scar? Yes, it can be. Why? Because it's another inflammatory process and another healing process. Next. So that's why scar revision is a useless operation. One of the articles from 2004. Next, please. Now, what's the difference? We have hypertrophic scar. You can see that both amount of collagen is more and also the extracellular matrix is more. In case of keloid, there will be excessive collagen with haphazard distribution. Next. HA, which is the hyaluronic acid, it's most abundant in skin, but also it can be seen in other tissues like on the ear and the cartilage. The function include hydration, lubrication of joint, and the synthesis of HA increases during tissue injury and wound healing because it will activate inflammatory process and also for network for the blood vessel formation. Next. HA is synthesized by a specific enzyme which is called HA synthetase, and it can be degraded with hyaluronidase, which is our subject today. HA can also be degraded non-enzymatically by free radical mechanism. Next. Next. In addition to human, hyaluronidase have been found in a variety of venoms like snake, lizards, and insects. And this is an important material for diffusion of the toxins. Various species of gram-positive bacteria like Staphylococcus aureus are capable of producing bacterial HA lysase as a potential virulence factor to promote tissue penetration. So again, it's of benefit for the bacteria to be grow more and more. وهنا الحقيقة سمعنا إنه في جامعة البصرة صنعوا أو من خلال البكتيريا إنه عالمتين استطاعوا أن gold particles from bacteria حسب ما شفنا بالأخبار. Commercially available HAD is either a human genetic recombinant hyaluronidase, bovine, from cow, or ovin from sheep. HAD has an immediate effect. The half-life is a few minutes with the duration of action 1 to 2 days. And the dose will depend on the indication of use. Commonly, we can use it for the complication of hyaluronic acid infection, overcorrection, I mean. It usually starts with this dose, 1,500 international unit. Also for the hematoma collection can be used in this dose, the same, while in ophthalmology only 15 international unit can be used. Next. The common uses are adjuvant for infiltration anesthesia, for complicated cases of filler in case of vascular occlusion, blindness, delayed onset nodule, allergic or immunological reaction to the hyaluronic acid dermal filler. It can also be used for the treatment of post-traumatic facial hematoma and fibrosis, in addition to vitreoretinal surgery. So I recommend to put the hyaluronidase in your pocket because it is of vital importance. Next, please. Regarding the scar assessment, there are many types of scar assessments. بإشراف أستاذ زكريا في عام 1997 كان عندنا thesis عن السيليكون جel. It was first to be used in Iraq, and we developed our own scar scoring system because later on Vancouver and Goodman published in the articles, next, while our RIHIT score from that time was depended in our study, it depended on 5 parameters: redness, elevation, hardness, itching, and tenderness. Each of these parameters ranged from 1, 0 to 3. Next. We have 20 patients, 8 of them hypertrophic, 12 are keloid, and we include all these patients. The exclusion criteria were, at that time was age under 18, pregnant women, and no case of sensitivity to HA days. We completely excise the scar, and we inject the hyaluronidase at 0 time, 2 weeks after and 3 weeks after the operation. And we follow up our patient for 9 months to see whether there is recurrence or no. Next. So these are the results as accumulation of RIHIT score before and 9 months after. 55% of patients reported no residual symptoms following a period of 9 months. 10% had residual redness, 15% had residual hardness, 25% residual itching. People with Fitzpatrick type 2 and 3 have better response in terms of RIHIT score, and immobile areas like on the ear showing better response. So patient with ear keloid, we excise the lesion under local anesthesia, and we inject the hyaluronidase with the same schedule. After 9 months, there is no recurrence. Another patient with a scar on the neck with acceptable results. While the patient with recurrence was a longitudinal scar along her left elbow, she presented to us with a recurrence and some wound dehiscence occurred during the healing process. Although the first discovery of hyaluronidase was in 1954, but their commercial use was in 2014, when they start using it in combination with 5-fluorouracil and triamcinolone. And in 2017, a case series done by Walina used small volumes of bovine hyaluronidase showed reduced redness and cicatricial pull on adjacent tissue. So we found that hyaluronidase has good beneficial effect that encourage us to continue this study on larger population for longer period, because our study was done during COVID-19 era. So we hope that we can expand this for the future, and maybe we have an idea to add toxin as well, because the Botox also will reduce the incidence of hypertrophic scar. So for a patient with a flat wound, with a flat scar like this, previously I go forward to do surgery, but it's an open discussion for you what to be done for such a scar. Still it's flat, hyperpigmented little bit, but it crossed the nasolabial line. What's the best to be done for this patient? Next. Thank you very much. We welcome you at any time for نجف. We will see together. نجف سي بحر النجف، وأيضا راح نتناول الفسنجون النجف.